And is it recording?
Yeah, yeah, it's recording.
Maybe it went deeper. No? No.
Doesn't have a long cable in there, so.
I won't do too much. I don't like that thing in my face. I guess I can go. Yeah, I'll mostly be here. So, like, maybe like, is that okay?
I can see until his shoulder.
Okay.
So it's presenting everything fine on there, looks good? All right.
Oh, that didn't work. How do I move that? How do I move these?
To go move aside.
There.
It should be, you just have to click into it. And you can
Oh,
go
okay. Okay.
Yeah. But there is work on.
Oh, there she is. I knew she was coming.
Oh, yeah, that's
sort of in the vicinity.
Okay. Still under construction.
We only have an hour today.
Mm-hmm.
Yeah.
Yeah.
Yeah, it might have thrown things off a little bit. So maybe we can get started. Is that okay with everybody? And I'm speaking into this, is that right? If there's, because there's people on the line. Okay, so hi there. Hopefully you can hear me on the line and as well as in the room. So we always just give a little spiel at the start to just remind people why we started the health research seminar series. Was part of an initiative of the HRI to bring together health researchers, and our goal has been to try to showcase local researchers who are doing health research in the various disciplines within health research. So we try to diversify a little bit, and we have quite a few sponsors or contributors from across the School of Health Sciences, including School of Health Sciences, Nursing and Social Work, the Northern Medical Program, the Psychiatry Program, and then we also have some funding from Sun Life Financial that was given to RI, so this is what supports the seminar series. So today we're very lucky to have Dr. Sean Maurice from the Northern Medical Program here to talk to us today. Sean and I actually started our positions at the same time, or within months of each other at the Northern Medical Program, and actually we interact a fair bit because we are both biomedical researchers. Sean does biomedical research in the lab building over in Building 9 there, looking at fibrosis. Used to be mostly in liver and now also in breast cancer cells, and I'm trying to convince him that adipose tissue would also be a great place to look at fibrosis. But today he's not here to talk to us about that research. Instead, he's going to share with us some of the work he's been doing for many years now on the Roadshow, really a community outreach project in his role as a faculty member with the Northern Medical Program, but it's more than a connection to medicine. It's to all health professions, and it's really what I would say is one of our most established pathways program for our program for sure, for UBC Medicine, and I'm not sure the impact on the other health programs, but I'm sure you'll be telling us. So welcome and thank you so much for sharing this with us. I think it'll be really relevant for our people who attend. And just to remind everyone that the talk does get posted online, so just so you know, we do have some people visiting the presentation following this. Yeah. Oh, I have one more. Oh, sorry. I do. Yeah. So just to advertise the April 9th date will be for students. So we did this last year. We had a Pechakucha that we did for the students. This year we're doing the Health Sciences Honors Students presentation. So I always sort of end up going into different areas for the student presentations at the end of the term. We often have the biochem students with the biology students, or we sometimes have the health research science students. And I just want to say that every year I am so incredibly impressed by the quality of work that is done by our undergraduate students. So if you have a chance to come out, they are really great, and they're shorter talks. They're like sort of 10 to 15-minute talks with different topic areas. So probably of interest to most people, I would think. Okay.
Thanks so much, Sarah. And I'm glad you started out with talking about my basic science work, because part of what I wanted to talk about today is academic generalism. So, actually, I don't know what to do here. Sorry, give me half a second here while I figure this out. No, it's okay. Nope, not that one. Is it just behind it? Okay, sorry about that. Thanks for coming out. I know some of you will have heard versions of this story before, so I tried to change it up a little bit. I wanted to talk a bit about what the Roadshow is, part of what we're doing to grow it, and a little bit about intellectual property and academic generalism. And we're coming up to 10 years of the Roadshow having been conceived and being in existence, so it seems like a good time to provide a bit of an update if anyone's heard an earlier version of this. So I don't have any disclosures, but I do have a couple of disclaimers. I'm not from northern or rural BC, so I don't have a history of not having a family doc or access to a physiotherapist, even though I've always enjoyed exploring this province and visiting the less populated areas. Roadshow is not my idea. It's been the lead since the get-go, so I feel some ownership, but I didn't come up with the idea. I'll tell you who did. And I acknowledge I'm among great peers at this institution. I think there's a lot of creative people, a lot of people doing generalist things in academia, even if they have specialist areas, because that's part of how we survive at this university. It's part of what we need to stay engaged with our community. So I just have one story I'll tell you, and I am no expert, and there might be some people who are experts in developing a community engagement initiative. I don't know if you've heard of PhD comics, but I find them pretty funny. So I have no idea, but somehow this thing has been a success, I think, over the years. So 12 years ago when Sarah and I were hired here, I was pretty captivated by the story of this medical school that was really fought for by the community. And in fact, the university was fought for by the community however many years before that. So I wasn't at this rally. I didn't know this story until I came here, but it's a pretty compelling story. The medical school had anxieties in its first years about whether it was going to be able to graduate students, whether they were going to get residency placements, whether the Canadian physician community was going to accept them, and whether they were going to come back. And all of those things, I think in really simple terms, all of those things have been successful. Our students are doing great. They're coming back to Prince George. But based on this history of the public investment, since I've been here, I've been really curious, does the public see what we're doing? When Sarah and I were first here, and we had the first grad class of the NMP, the Prince George Citizen reported this kind of negative, only 30% of medical students staying in Prince George when we had our first grad class, which was not very surprising because we only had 8 residency spots to be filled, and 7 of them were from the NMP. That was actually a pretty big success, but the new spin on that was sort of negative. So I've been curious, what do the people think, and is this working? So in 2009, 2 years after I was here, without very much understanding, aside from the simple story of that rally in 2000, I signed up quite naively for this conference called the Rural Health Workforce, a Collective Commitment to Action. I didn't focus much on that action word. I went just for information. And there'd been several meetings leading up to this, and of course, a long conversation with rural docs and rural health practitioners. At the end of that meeting, this character, Bob Willard, stood up, who's a legend in rural medicine in this province, and of course, I didn't know who he was, and he challenged everybody, the meeting participants, to do something, this action piece. What are you going to do within the next year to help address this problem? And the group, I was sitting at a table with people I didn't know, but another table had, among other people, Dave Snadden and Shelley Sim, who's a counselor and runs a small business and does lots of things in Clearwater, and they came up with the idea of the Roadshow. So that's where it came from, and I went to Dave at the end of that meeting, who was at that time my boss, and said, Dave, if there's any way I can help, that sounds like a great idea, let me know. And he said, Sean, you can have it. So that's how I became the lead for the Roadshow. And over the course of that year, Dave provided some insight as I asked for guidance, and Shelley had provided a lot of help as we worked on figuring out what the model was for that first trip. We went to Clearwater. So the goals were, and these haven't changed, so maybe we've added a little bit. From the get-go, the goals were to provide a healthcare professional exposure to rural youth, to provide rural exposure to healthcare professional students, and to provide an interprofessional experience to healthcare students. The format was to be interprofessional, and so I'll show you a little later a more comprehensive list. We've had about 25 different health professions represented over the years now. I've got medicine underlined there because the medical students are now involved in helping to plan, so they're not only getting the experience of working in the interprofessional teams, but they're also engaging with the community leaders and helping to design the course of the week and doing research on the rural health workforce as they do their planning. When we go to community, the students do short formal presentations, so that would be like on the left here, this is me, but students would stand for, give a 1-minute PowerPoint, one slide, who are you and why did you go into medicine, nursing, whatever. Students sit in the bleachers, and then the really interactive part is the students go around to tables where there's lots and lots of equipment, and they do short presentations with the healthcare students for between 5 and 10 minutes. So this is Delaney, he's a nurse, and he's talking about the size of the heart. So you can see these students are mostly fairly engaged, listening and interacting with him, and they're going to do some intubation here, it looks like. But so we bring truckloads of equipment, lots of different types of things, and get them interacting and thinking about what training in this career might be like, and in small groups where they can ask this healthcare student who's still usually young and in or recently exited from one of these training programs, ask questions. Is it hard to get in? How much money do you make? Whatever it is that's on their mind. And then to round out the trip, we take the healthcare, this is just focused on the healthcare students. We go and we tour local healthcare facilities. We go to hospitals. Sometimes there's unique care facilities, so we try to give them a bit of a perspective on the different types of practice facilities they could be working in if they were in one of these small towns. We meet local leaders, mayors, and councillors, and sometimes we have dinner. Sometimes we go over to the mayor's house or a local physician's house, and those are pretty unique opportunities that I don't think you really have if you're training in Vancouver. And then do something fun in community. So this is, we were pretty lucky in 2016 to see this pole being carved at an old masset on Haida Gwaii. This is actually the reconciliation pole that stands at UBC now. So we saw it while it was being made. That was just quite coincidental. We were just inquiring about something fun to do. We've been jet boating and gone for hikes and done lots of different things. So why are we doing this? I just signed on naively, but the smarter minds that came up with the idea I think knew the literature better at that time. But there's a physician maldistribution, and this is true for a lot of other health professions, that we don't have as much data. So this is just referencing one recent paper. About 17% of the population is rural, and only 8% of physicians are located in rural areas. And this does not account for the increased number of physicians and healthcare practitioners required in tertiary centers. We know that rural youth are less likely to have confidence that they can get into medical school. They face greater challenges and greater barriers because they might not be able to do the same sorts of extracurricular things if they're living in Fort Nelson. They might not have academic parents, et cetera. And it's quite a long ways away from home to go to Vancouver especially, or even Prince George in some cases. But we know that healthcare professional students of rural origin are more likely to return to a rural setting and take up practice. And we know that community engagement is important. So this is just a figure from 2005 paper by James O'Rourke on behalf of the Society for Rural Physicians. And there's a number of things here just underlined in red that I think the Roadshow is doing, recommendations on establishing university high school outreach programs, et cetera. So this is a video this is my experience in creating videos. I have a lot of students involved in creating videos, and I thought I really need to get some experience. So I had my 13-year-old teach me how to use iMovie, and this is the summary of the 2 roadshows last year for 2 minutes.
They might not have practiced before, and it also provides an opportunity. Job in healthcare, or they did an initial presentation where each of the corporate professions and how they got into it. They go through the stages. Now, it seems to have a lot of and give them some skills to work. We were healthcare. Teach them a little bit about the actual realities of practicing. So coming up here, I was showing up some students who were looking for work up here. It's a great student, and yeah, bringing the lifestyle. Yeah.
I don't know if I have another career in videography, but it was an interesting learning experience. So this is a summary of the geographical areas and some of the numbers of students who've seen and healthcare students who've participated as of 2017. So we did another 3 trips last year. We went up to Dease Lake and Watson Lake. We went out to similar to the 2014 area, and then there's a Kelowna-based trip also. So we've been doing program evaluation over the years, and overwhelmingly we've had a lot of support for what we've been doing. We asked some Likert scale questions, and here students are answering, or youth, community members, and healthcare students are answering on a scale of 1 to 5, how successful they thought the project was, whether it'll likely help healthcare students consider settling in a rural area, consider local youth to consider careers in healthcare. And mostly everybody thought quite highly of this. The least high score was for the community members, and do you think this project will encourage healthcare students to consider settling in a rural community after graduation? And this may be that they're more realistic, having lived experience there, or that they didn't see all of the aspects of the roadshow. You don't know, but I think overall this looks pretty positive. We did some qualitative analysis of the themes from the longer answers of what they liked about the roadshow, what they thought could be improved. They talked a lot about sincerity and interactivity, sparking enthusiasm. So lots of comments about everything being hands-on. Teachers talked about how we reach out to the average student. So we do try to see if we're going to a town and we have sort of some metrics for sort of estimates for how many students we can see. So if we go to someplace like Fort St. John, there's too many kids. And so we'll try to see all the grade 10s rather than seeing all the keen kids from grade 8 to 12. And there are other initiatives that target the keen kids, the kids who apply or get parental permission or something. And we've chosen to try and see all the kids in a certain age, hoping that not only will we give information to the keen kids, but we might be able to spark some light bulbs for kids who have the potential and just aren't interested or don't see a reason to be trying hard. And maybe some of them will pick up their grades or start thinking about university when they hadn't before. I won't read all of these, but there's 3 other themes that we came up with: learning through rural exposure and community engagement, healthcare student personal growth. Students talked about the challenge of having to talk about their career in front of all of these kids. We have students who've been teachers before, and it's no problem. We have other students who feel quite uncomfortable in that environment. And the interprofessional collaboration and development was definitely a highlight for a lot of the health team. They're just really excited to meet people in these different programs and hear about their careers and their perspectives, whether that's while you're driving in a vehicle or you're setting up the little presentations and discussing who gets to use the giant ear in their presentation or whatever it is. So over almost a decade of running this, we've learned that representing a diversity of healthcare careers is important. And we knew that from the get-go, but that really has required provincial recruitment. So we used to just recruit for Prince George and at UNBC and CNC, where we have 6 different healthcare programs. And lots of people think it's a great idea, but few people actually committed to taking the time to do it because they're all busy. They don't have a lot of vacation time. And we also, of course, don't have midwifery and a lot of other programs. So we needed to be creative, and we increased our funding in 2015 to provide travel to bring students up from the Lower Mainland. And we also realized that for them, it can be an eye-opening experience for them, even if they don't. We could convert somebody to rural practice, or we could at least give them some real exposure to what rural practice challenges and opportunities are, so that when they have their job in a tertiary center, they have a bit more of an appreciation for their Fort Nelson referral in the future. We, at times, have done presentations to over 150 students and realized that was just too much for the small tables to be effective. So somewhere around 60 youth is actually pretty ideal, where you're seeing enough students per presentation, but they're having a really great experience and they're not getting lost or not wandering away and going onto their phones because they can't see what's happening. A lot of stakeholders involved in community engagement work. So, and it's important to, although we try to be kind of grassroots and it's a simple initiative, we just get out and do this thing. It's pretty important that everybody is on the same page and that you've had all those conversations. If you show up in town and the press doesn't know you're coming, but they wanted to know you're coming, if the healthcare team didn't know you're coming and they wanted to be part of the socials, but they're not available, you hear about it and people, it's nice to have everybody involved. Communicating the vision takes time, so when we're planning and we're reaching out to somebody in community, a lot of times initially they see it as work instead of seeing it as an opportunity. And usually by the time they've talked about it a little bit and understand what you're offering them, because we have the funding, we do most of the planning. It's not a lot of burden for a small town, but in some cases that's still the initial response is, what do you need from me? In a negative way, and once they realize what you're offering, they're usually pretty excited. And a lot of times we've had people who are not, who are slow converts. And when you arrive in community, they're like, this is fantastic. Can you come back next year? And I think, is this the same person we were talking to 6 months ago? Important, there's a necessity for ongoing dialogue with the healthcare professional programs province-wide. This is part of our recruitment for the students. And yeah, as I kind of said, this grassroots initiative has a lot of moving parts and a lot of people involved. And as it grows, we're trying to standardize our processes, but maintain flexibility, sincerity. We're now operating out of 3 different sites, province-wide. And so I didn't start in this thinking we're doing community engaged learning, but this is kind of a hot term now. And so just for fun, I looked up a couple of different definitions of what is community engaged learning. There's a center at UBC, apparently, and their definition is just allowing students to engage beyond the university and tackle complex real-world issues in a collaborative environment. I think we check all of those boxes. This is from Stanford. Quite a verbose definition here by comparison. The only thing that we're not doing is this intentional integration of learning objectives. And I actually think that's an okay thing. I think that there's a lot of things happening and we have our fingers on most of them, but we don't try to control that too much. We just have sort of goalposts and parameters for how we do this, and then each trip has a bit of a different feel. So 2-3 years ago, we thought, we're doing a good job. We're getting out and we're seeing a lot of communities, but we still have about a 6-year turnaround before we go back to a community that we've been to once before. And that means a lot of kids aren't seeing this, or when they're in grade 10, or if they're in one of the off years, they might hear about it or they might not, but there might be a way for us to stay better connected to those communities, to those counselors, and to provide something that the students can use year round. And so we decided we needed to develop this virtual roadshow that retained the essence of what the Healthcare Traveling Roadshow is. So we want it to be an online platform, accessible throughout the year, provide enough info, but not too much. We're really trying to be a seed planting mission, not a recruiting mission, and to retain the essence of what the Roadshow provides. Okay.
Medical knowledge and leadership nursing foundation. And a chance to elderly patients and to do that on a really long-term basis. And to give the action the patient priority. In BC, there are 3 different schools that will provide the master's degree for a family nurse practitioner. There is University of British Columbia, University of Victoria, and University of Northern British Columbia. A nurse practitioner degree is a cumulative degree. And we start off with typically 4 years of an undergrad nursing program. Following that, you must have at least 2,000 clinical hours. Roughly 2 years. And after that, you are eligible for master's of family nurse practitioner.
So we have about 11 of those videos now. They're made by students, medical students, and they feature a single career in the words of the student training in it, which you saw there. That was Esther, who came on the Roadshow that year, and she was doing her presentations and on the side doing this video. On the website, we have a very brief written summary and then links to training sites in the province for more info. Again, we're focusing on seed planting, giving enough information so they can consider different career options, have a taste of what they're about, and then if it ignites some interest, they can go to those other websites. It'll provide the GPA and courses you need and more official information. So these are professions that we've done thus far, and these are some of the other professions that have been on the Roadshow over the years, and we haven't filmed yet, but hopefully we'll be adding another 3 this year, and we'll continue down that road. Hopefully this at least provides some of the diversity already to give students a taste. So we have a bunch of partners who are engaged in this. Schools, the towns, health authorities in northern and rural BC, academic institutions across the province. When we make the videos, most people are really excited to see them, but it's pretty important that we engage everybody and make sure everybody's happy with the content. Because if you get most of it right and you say one thing that's quite wrong, you're going to hear about that one thing, of course. So we have an engagement strategy where we just make sure that everybody has seen it and they've approved it before it goes up on the website. So the website is up now. We haven't quite finished polishing off the last few careers, and we're going to do a launch rollout hopefully really soon. If you go looking for it now, you can find this. There's a couple other things on the general Roadshow page that are going to change, but this is what the index will look like. It has of the 11 that we have now, just sort of all in order, and then if you click on them, you'll get the access to the movie, the description, and the links. And you can also filter by level of education, because we've learned that's a very common question from high school students who've never considered these careers. How long does it take? Fair enough, you're in grade 10. Yeah. I would want to know too, along with how much do you make, right? So we've got that. We don't have the how much do you make, but we've got how long does it take on here if they want to filter by certificate program, etc. So I wanted to switch gears a little bit, because this has gone from being something that I did for fun as a side project in the first year to kind of one of my main things, and it takes a lot of time, so I feel some ownership. And I thought it would be appropriate for the generalism title to just show this picture of Dave Snadden. I don't know if probably you all know him. I don't know if you've all seen this picture of him. This is a picture that was on the website when I applied to this position. Do you remember that, Sarah? It was brief. It changed out. Yeah. I looked at I was still working on my PhD, and I saw this ad, and I thought, oh, I don't know, is it time? But I'm worried about what's next. I've got kids. I've got no money. This is important. And I saw this picture of Dave on the website. I was like, I can apply to that guy. He'll understand me. This quote is kind of silly and pretentious, but I sort of like it anyways. A human being should be able to change a diaper, plan an invasion, butcher a hog, con a ship, design a building, write a sonnet, balance accounts, build a wall, set a bone, comfort the dying, take orders, give orders, cooperate, act alone, solve equations, analyze a new problem, pitch manure, program a computer, cook a tasty meal, fight efficiently, die gallantly. Specialization is for insects. I can't claim to be able to do all of those things, but I did come here with a background in outdoor leadership, an interest in life sciences, or training in life sciences research, and interest in instructional skills. And it was kind of exciting to find a place where all of those skills were actually valuable. And so this is me at the confocal microscope. This is me in the back of one of those canoes working with First Nations youth paddling down Babine Lake, where I helped to make leadership decisions, taught shelter building and campfire building, and also talked about the anatomy of the male reproductive system, and hopefully was able to kind of be culturally appropriate and have a bit of street credit while also being an academic influence in those lives, maybe. This isn't the end, but just speaking about the partners involved in this initiative. Normally when I talk about this, I do end with 2 thanks slides. This is one of them, and I acknowledge the funders and the supporters of the initial Roadshow. And I like to tell people about the Northern Medical Programs Trust, which people here might know about, but this is an endowment fund, which is something the Northern Medical Program has, but the other sites of UBC Medicine don't have, where the communities and companies and individual donors came together to support our medical students and healthcare students in the North in getting out of Prince George and going and seeing the smaller towns. So it's kind of neat. It's a neat part of the story of the community engagement in our program. So they helped fund us and have from the beginning. And this is only current as of 2016. These are some of the partner towns and school districts and health authorities and organizations who've helped to fund and support the Roadshow. And all of these have contributed in some way to the success of the Roadshow. And I say that because while I feel some ownership of the Roadshow, I also like to acknowledge how many organizations and how many people have been involved in its success. And so over the years, there's been this trend of UBC taking credit in some form for the Roadshow. And, in 2014, it was still pretty new, and the president of UBC said, hey, this is a great thing. I thought, hey, this is great. The president of UBC is acknowledging the Roadshow. But, when I look back on this, it says UBC is addressing a need in the community. And I think, UBC is part of it, maybe a small part of it, actually. I guess I'm part UBC, and Dave's part UBC. The NMP is definitely part UBC, but I think there's other partners that are an important part of it. 2 years later, Warren from the Southern Medical Program came along on the trip and made this video. And this, I think there's links to the Roadshow website through this, but it's really focusing on UBC students here. And there's a lot of students who aren't UBC students on that Roadshow. And actually the Roadshow, my fund, paid for Warren to come on because I was trying to get the Southern Medical Program trip going. Roger Wong, if this is all just me complaining and groveling, I'm sorry, but there's only a couple more. Roger Wong is the Executive Associate Dean Education for UBC. Interestingly enough, that he's writing on medical education and rural health. He talks a bit about the Roadshow here, and I wasn't aware of this until my dean saw this publication and mentioned it. Fair enough, it's a thing that we're doing, I guess, but it does make me think about intellectual property. And if you're talking about somebody's research, would you talk about it as though it was your own and not talk to them first and not give them credit? I don't know. Last, 2 years ago, UBC Medicine decided to start up this sort of digital magazine called Pathways, and their first issue was on social accountability. And the first item under social accountability of UBC Medicine is the Roadshow. It's kind of cool. And this article does a good job of giving me credit and the Northern Medical Program credit and credit to our funders and partners, at least some of them. But actually, this was written without consultation with me, and without including me or the funders until Sonia Kruger, our communications person in the North, got wind of it and said, hang on, that's not right, and then invited me to work with her in modifying it a little bit. So sorry if that's just me complaining, but I find it interesting thinking about intellectual property when you look at the basic science research versus a community engagement project, which isn't necessarily focused on publications in its essence, but does involve a lot of someone's time and I think intellectual guidance and property. So as we're updating the Roadshow website here, we've tried to make sure to give credit appropriately to our sponsors. So we've just changed this recently. These are the sponsors who've contributed money. These are the founding sponsors who made it possible initially, and these are other people. And so UBC Medicine is down here, which I think is appropriate, where it's a part of a lot of aspects of it, but they've never directly given money. And as we're moving towards this becoming a bigger initiative, we're trying to formalize our policies. We're also realizing we probably need to make it a research initiative. We've submitted a paper just recently, and I might point out that we have faculty from UNBC, we've got students, we've got somebody from PT, we've got 2 people in communications. We've got Shelley, who's not an academic at all, but is a counselor and runs a small business and is one of the people who came up with the idea, from Clearwater, a rural physician, and Dave. So a team of people who really have made the Roadshow what it is, not to mention all the other communities and partners. And then Neil and I, along with some others, had a successful planning grant and had a great meeting in the fall talking about how to measure the impact of this in the long term. So we're just in the process of refining that idea. We're speaking with the RCCBC about possibly getting some increased funding to allow that growth, and working with colleagues at CHESS at UBC, having just made fun of UBC. CHESS is a great resource at UBC, and so they're offering a lot of support, or some support and guidance in that conversation. So that's my story. Be curious to take any questions or comments if you have any. Right, the IMP in Victoria. So that's new this year. Yeah. They are. They're going up to the North Island this year, and so Hamish in that class has been a star. This is the first time that we've had a student really build it, a new site. So he's been asking all these questions about, like, how do I talk to these executives from Island Health and ask for money? I don't really know how to do that. And what do we do when we get the money? Where does it go? And we've been helping him figure out how to work with finance and stuff there. And we think we found him an academic supervisor there, or a supervisor for the future, because you really need somebody other than me who can supervise students on the ground year after year for it to be sustainable. Right now I'm supervising Hamish, but yeah, so this year will be the first year on the island, and we think that we have everything in place that it can continue. Yeah, but it's a little bit of making it up as you go, and it's been fun. Yeah. Margo. Oh, right. Thanks. Okay.
But thanks so much I've been wanting to have this chance to sort of hear more fully about this initiative for a while. So I really appreciate you taking it. And as somebody who is really actively involved in this sort of this zone of community engaged research, I really appreciate the fact that you've those questions, and I'd actually just like to dig into some of them a little bit further. And we share something in common in the sense that good old Bob Willard is probably partially responsible for me being here, and because of the way in which he spurs other considerations. And the reason I mentioned Bob is not just to make that connection, but Bob was somebody who challenged me to think about scholarship in a way very early on when I was considering whether or not I may end up entering into applying for university jobs. And I found it really useful, and I keep returning to the notions of the beyond the classic 3 forms of scholarship that we all know so well that have been articulated. tenure and promotion packages and the sense that we have to be focusing on the scholarship of teaching and learning, no surprises here, the scholarship of discovery, research, and the classic, which is the way that a lot of research is framed, and then the scholarship of in our area we often think about service, and this idea in which service kind of can be unpacked in all sorts of ways. And in some of these core foundational sort of papers, Boyer cites scholarship of teaching and learning, scholarship of discovery, but he also refers to the scholarship of integration, which is something that's very interesting to me as somebody who works across this. But importantly, and Bob extends this a little bit, there's also the scholarship of engagement, which is part of what you're describing here, and then the scholarship of application. And it's very interesting for me as a researcher because I spend most of my research world in the scholarship of integration, application, and engagement. And I'm interested across all five. But I'd really, as you pursue this, I just wonder whether those words kind of resonate for you, whether you've found yourself in that little curiosity of trying to understand what kind of scholar you are becoming, because I think that's evident from how you present it. You're presenting scholarship and sort of then owning the fact that I didn't even realize it, but I'm becoming another kind of scholar, and I'm curious about how to do that well, including criteria for what's acceptable and not acceptable, which is what you've done. You're sure you might be raising critiques, but you're exploring the notions of what's good practice in this context. What does it mean to be valuing scholarship? So I just wonder if you can reflect a little bit more on this idea of how much you value this as a form of scholarship, okay? And what that's meant for how you sort of thought about this whole idea of what's scholarship and what's research and how it's challenged you.
That's a big question, Margot.
Don't try to repeat it.
Margot just reminded me for folks online that I should be paraphrasing questions after they come in so you can hear, in case you couldn't hear that. So in short, no, that was fantastic. I think you summarized a lot of important thoughts there, and I was hoping to generate some thoughts on, if the university wants us doing things like this, if this is good for the reputation of the university, how do we, what should the university be doing, or how do we take credit for it appropriately? So scholarship of integration, scholarship of engagement, I think those are great ideas. I mean, writing and submitting that paper was interesting because we do have conversations at the NMP about how rural health isn't really valued in our publication-driven metrics because rural health journals aren't cited a lot. And so if you care about your H index or something, you're publishing the same number of journal articles as the next person who's in biomedical sciences, the impact factors and the H index isn't anywhere near as high. And we submitted to a couple of journals and got some really interesting feedback. The Journal of Rural Health basically said that we're not interested, you should look somewhere else. No explanation, no nothing. We submitted to CMAJ Open, and they were very concerned about rigor in the methodological analysis. I think rigor is important, but this wasn't meant to be a very rigorous methodological paper. It was meant to be a paper that tells of an initiative and tells of some analysis, but the balance of it we thought was a compelling enough story. And I think research is always that way. There's times where you're focusing a lot on one thing, and then it has to be very rigorous, and there might need to be several different forms of analysis. There's times where you're coming at something from a lot of angles, and then each individual piece might not need to be quite as rigorous. So, it's as we've been trying to think about how do we make this research, how do we engage in the scholarship of communicating the idea and making sure that we can survive as academics, investing a lot of time and energy into something like this. It's something I think a lot about, and obviously I'm sort of working through it, and so I appreciate being able to bounce some thoughts off you. Might be asking if I can buy you coffee sometime.
Mm-hmm. Well, I mean, Rachel was, I know, is interested in how we can serve, how the HRI can serve UNDC research community. And I think this particular sort of zone of when you're doing this sort of more applied, responsive, community engaged research, how to package it in a way that is that sort of retrospective coherence that may need to occur, so that we're not undervaluing it. It's not about trying to get recognition where it's not due. It's actually figuring out how to translate it into these different ways. And I do actually think that for this university, it's actually a really important thing, because if you look at the university as a whole, I think the university CV isn't bad in doing this stuff, but we don't even know how to. We don't often universities are not very good at figuring out how to give it the necessary traction. And so we end up, the joke, when I was at UBC, the joke was, oh, that's the sort of thing that'll get you on the UBC website, but not very good for your tenure.
Yeah, totally.
So, and I feel like that story. So we all have to be it is for you to raise these questions. I think that we actually have a collective as colleagues who are struggling with their mechanisms that work, that can actually help and enable things to achieve an adequate value. That it's not the same as, we're not trying to make this the same as discovery research, but it's got a different suite of contributions that. And how we communicate that's very difficult. And I literally came from a very interesting conversation before this about literally the Common CV and the CHR CV and the sections in the Common CV and the CHR CV that ask you to elaborate on your knowledge translation and there was one other category that I've just blanked on. But there are two categories, knowledge translation and outreach and communication. I can't remember what they were, which is irritating me, but there were two categories where we don't know how to translate the innovation of this work into those absurd forms. We know that they're now asking for those sections to be filled in, but we don't actually know how to fill those sections of the CV in a way that makes any sense. And that we don't want to take all the innovative parts of our CV and put them in those sections if they're not then going to be counted in the harder sections of our CV. And I think that there's this is not about it's not about a CV, it's about valuing the importance of the work, which is, I think, and I wonder, in terms of those currencies, how you value this work as part of the suite. Putting aside the currency of academia, how do you value this work as part of the suite of your country?
So, I mean, a simple way to say that is I think it's important, and so I do it. And yeah. I mean, that was sort of the start of it. I have the capacity to do this. I think it's important and we need to do it. So, and I have definitely prioritized it over other things that might have been more valuable on my CV in the past because there were timelines and this had to happen. And I mean, one of the reasons we have CVs is also just to tell our superiors, tell our bosses what we're doing. We go for an annual review, and so sometimes when I'm trying to figure out how do I articulate this, I just think, I just have to remember that my boss is busy and he just doesn't know, even though he'd like to know. So I just need to make sure I find a place for it. So, and only pretty recently I thought, I don't know that I'm really articulating just how much we're doing with the Roadshow, just how much community engagement there is, how many times I've been to small towns and had someone say, this is the first time I've seen UNBC here. And so I actually started putting into the publications on my CV in the other, all of the press and TV episodes that we've had on the Roadshow that I'm aware of, and just in Northern BC that have featured me or the Northern students. Those are not first author publications or any author publications. But they're in the public sphere and they're representing UNBC and the Northern Medical Program. And so I have 2 pages of those on my CV, and I've put the funding in very recently on my CV. And in the North, we've had over $200,000 in funding to run the Roadshow for these past years. So that's some measure of productivity. But I wasn't trained to measure productivity in that way, and I don't know how it's received by my program, by the institution. If I was applying for tenure and promotion, would they see that as equivalent to, or how much of that would they see as equivalent to this other thing? I don't know. And I mean, I guess collectively we're working on that, but I think it's worthwhile to be working on that. So I still have a job, so I can struggle on and try to figure that out. And That's an adequate answer. I could ramble on, I'm sure, but. Are there any questions from the online there, Bree? Yeah.
Nope, there are none.
Yeah. Hi.
So for a lot of rural communities, bad words and
Yeah.
do you think this type of community good for the community?
Well, gosh, that's a great question. Thank you. And I think that I know in a lot of Aboriginal communities, when there's decent engagement, there's talk about how there's one of the quotes is, we've been researched to death. Maybe now we need to research ourselves back to life. And so I think when there's appropriate engagement, research can be empowering. I don't know if you went to the average high school student or even community member who's been part of the Roadshow and seen the Roadshow come through, if they tell you it was research. Maybe if you told them it was, they'd say, okay, I can see that. So that would be an interesting part of it. But I think we really try to engage sincerely with the communities we go to. We don't do a lot of specifically First Nations visits because in a lot of cases they don't have schools, high schools on reserve. They do have some. So there's one in Fort Nelson that we've been to, for example, and we have been to some elementary schools when that's appropriate. Like in Old Masset, we went to a K-5 school and had a great time there and had, I think, a very impactful visit. We had, in that particular place, we had a teacher in tears because she said, nobody ever comes here. So, which is sad, but also great that she was excited that we had made the effort to come. Yeah, so I think we've been far and away making a positive impression on the communities, that the university is reaching out and wanting to do something positive, that the intent of the project is right. But relatively little First Nations engagement. Aside from, it's always one of the questions we ask when we're going, is there a First Nations high school? But more often than not, those kids are coming to a shared school. So there isn't a separate piece for that. We have, for example, in Southside, out by Burns Lake, we went to, there's a school in Southside, although it's largely, but not all, First Nations. And there's also a very creative shared healthcare facility there that has a wing that's for allopathic medicine and a wing that's for carrier medicine, and has carrier, what are they called, community health representatives who aren't professionals, but who are sort of more in the social work sort of domain, just helping patients navigate the system. So we engage those elements when we can. Thank you for that. So I probably need to go. I have a 1 o'clock commitment.
I went to the Roadshow in Quesnel last year, and what really struck me around the community is that it was very much about the presentations to the students and the students' education, and then the whole other side was about the community really pushing the recruitment for the healthcare students to show off their town. So it was like, if you're part of that, the whole experience, you see like completely two almost objectives of the
yeah,
right?
And the community often are very excited to be able to show off what they have.
Yeah, so in Quesnel it was just over the top, like they were so excited to have it. So yeah, it was really, I've only been to one, so that.
Thanks, Sarah.
Anyway, thank you so much. That was fantastic. And thank you to all of you who came today to hear about the Roadshow. And yeah, it was wonderful. Thank you. It was a lot to think about and a lot to talk about. So thank you.
Yeah, thanks.
You have to teach, don't you, at once? Oh, you're
I'm not teaching. Okay.
Right. I knew there was something at once.
That's okay.
So thank you.
Yeah, thanks for coming, Neil.
Thanks, Sean.
Oh,
Thank you, sir.
thank you.
Yeah.
Oh, I think I just closed it without shutting it properly. Is that okay?
I think so.
Okay.
That turns it off. That's so good.
I don't know what
Thanks for your Thank you.
Yeah, it's an important trade. But if you haven't seen some of Bob Willow, first of all, I can promise you that Bob Willow, if you haven't had follow-up conversations with him,
No, you go for it.
so love to have a conversation, all conversation with you. And you totally should. And he did, and I'm like, also with the really committed, although he hasn't dealt with it, he's really committed. So he, and his paper, social accountability, that whole world around social accountability, the last decade of his work, and he retired from being. And they have done a lot of things about exactly this and why it should. And he would advise, he would give feedback. Just tell him, Margaret Clark told me to write this and have a chat about this, because he also loves those stories of when I've seen him do it in lots of he's really excited about the environment. When he was down Dr. Water. So he got involved in uranium mining and environment. So he does the eco-health stuff on the side, and he's been really involved with that whole world. So I don't know him so much in his rural practice role, and now the reason I mentioned this, now is a good, well not good, but now is the time to contact Bob, because he's just time, and then coming weeks, months, because he's just finishing up his clinical practice. He's, he's nearing retirement, and he's just sort of, and this sort of stuff, figuring out how to tell the story, how to get it valued, how to be in discussion with people about it.
I'm keen to ask people wisdom.
And I mean, I think the thing is that what we do not achieve, what I